Yes,
Thanks,
we are.
Katlana. That's great. Thank you. And to remind everybody that the reason why we record the webinars is because we do have a dedicated CHSE weekly webinar YouTube channel that you can access through the faculty YouTube channel. And if there are things that you want to go back on or listen to, the records are all there. So we're looking very forward to continuing the discussion that we've had on ways of engaging people with teaching, using technology on the one hand, and some discussion on use of AI on the other, and to continue looking at our innovation space with technology. Today, we're joined by Amanda Jankowitz, and thank you, Amanda, very, very much for agreeing to come and talk to us. And Amanda gave a really interesting presentation at the SAHI conference, the recent SAHI conference, and she's agreed to tweak what she gave there into a discussion on game-based learning, and particularly the work that she's doing in the faculty in the School of Therapeutic Sciences. So Amanda, thank you so much for joining us today, and we're really interested to hear how your talk pans out. You must tell us if you're happy to take questions during the course of the webinar, or if you want people to save those questions till later.
Good afternoon, Shira and everybody, and thank you for having me. People can ask questions during the webinar or afterwards. If you will just let me know who has any questions, Shira, that would be great.
Terrific. Thanks so much. Off you go. Thank you, Amanda.
Good. Let me quickly share my screen. Okay. All right. So good afternoon again, everybody. And as Shira mentioned, Jennifer McAdam and I presented at SAHI this year. So I see there are some of the people in the audience that have attended this session at SAHI. Don't worry, I've tweaked it quite a lot in the end, actually, just to share with you a little about game-based learning and also around the work that we do here in the School of Therapeutic Sciences. And then I'm going to end off with what we can do for you as a lecturer. So first, I want to start with a poll everywhere. And the question is, what comes to mind when you hear game-based learning, the concept or the theme or whatever you want to call it? Let me just go to present mode. So there's a QR code at the top right, or if you have the app, you can join by using the app, or you can just go on the web there at the top left-hand corner. So what comes to mind, one word that comes to mind when you hear game-based learning? It can be a number of words as well. You just need to connect them using an underscore, please. So exercises. Someone else is saying online. I'm going to give everyone about another 1 or 2 minutes. So it seems like fun is taking the lead. Okay, learning, interactive, direct, self-directed, engagement, education, interactive. I'm going to wait for another 2 or 3 responses and then we'll carry on. Okay, one more. Okay, so it's online, making, self-directed, education, fun, game, exercises, engagement, interactive, and learning. So just a fun fact before we start with the rest of the presentation. There's been a lot of research about the fun side of game-based learning and gamification. And it has been proven over and over that the students and lecturers have fun while they develop games and play the games, but there isn't a lot of research around the learning aspect of it. So does game-based learning actually work in the classroom? So maybe if you're looking for a research niche, that's something to research. So thank you for your interaction with the poll everywhere. So it seems like fun and learning is in the lead, and then education, engagement, interactive, self-directed, and online. So let me go back to the presentation. Okay, so now the definitions of gamification and game-based learning, because it's still an emerging research field, there isn't a lot of clarity around what the exact definitions are. It also depends on where you are in the world. If you're in the global north, you would speak about serious games. yeah, if you are in Australia and South Africa, you'll talk about game-based learning. So that for that reason, on the outset, I just want to say for this presentation, gamification means you using gaming elements in a non-gaming context. For example, a leaderboard or on your learning management system, badges. So you get a badge if you complete an activity, and that would then inspire you to do a bit more work maybe. While game-based learning is where you put the student in the driver's seat. So the lecturer takes more of a role of a facilitator, and the student then decides where they want to go next, guided by the game that the lecturer has created. The reason why I'm interested in game-based learning and gamification is because I love it when students engage, and I also think that they learn better if they engage. And this is a good tool to get your student engaged, even with our bigger classes that we have at the moment. So now, why gamification and game-based learning in health sciences? So it boosts engagement and outcomes. Like I've alluded to earlier, there's a lot of research around it enhancing engagement and also the understanding of learning outcomes. But there's a lot of research around whether or not this works on the long term. But there's a lot of research coming out now around that, but that's kind of an area for development in research. You can scale up safely in gamification. We call it the fail fast principle. So in other words, you get immediate feedback and consequences. So if you struggle with something, then maybe you can't stop the bleeding or something similar. We don't let patients actually die in our games because otherwise students will remember that trauma. So we kind of stop the game 2 steps before death, to state so bluntly, so that the student kind of don't remember the trauma around the game. And then we also have built-in debriefing sessions because we're not always present when the student does engages with the game, and some of the students experience the games quite intensely, and then it takes you beyond the classroom. So it is a game is more interesting than maybe looking at your lecturer for an hour or so. In Ifundanati, in therapeutic sciences, we work mostly with Minecraft, but we also develop games and simulations in Articulate. We are expanding the types of games that we offer, but at the moment it's Articulate and Minecraft. So why we use Minecraft is because it's accessible to us at Wits. We have the licensing. It's also easy to develop, even though it's time intensive in the beginning. It's easy to develop, and then it encourages system-based learning. So I just want to showcase one of our projects with you. We have about 7 projects at the moment. So this is Arabang. So she was born back in 2019, and this is an occupational therapy rural project. She just want this to play while I speak. So she lives in her rural village with her daughter and other elderly woman. They only receive a grant and they struggle to get water and other resources. So basically the occupational therapy students are then tasked with doing certain activities, interviewing Arabang and her sister and a disabled daughter and everyone. And then that forms part of their case studies. I just want to go to the next slide. So for this, we had to design custom blocks in Ifundanati because corrugated iron didn't exist in Minecraft. So maze, neither did maze. So we had to design those blocks. That was part of the time intensive layout. What did the students learn from this project? So they had a better understanding of rural occupations, increased empathy and engagement. Like I said earlier, the students get quite involved and empathetic towards the characters in these games. And even me, as an adult creating the game, feel like I have a personal relationship with Arabang because he's been with me for so long. So the students do empathize with the characters, and then the students noted a difficulty with navigating in the beginning of the game, but after a while they got the hang of it. Gamification is also quite a good leveler of skills in a classroom, especially if no one has played Minecraft before, for example. So then everybody's in the same boat and everybody is growing and learning together. Oh, this slide doesn't want to change. Okay, so now in 2025, we are elaborating on this game. So we have the Ntulis that are moving in now. This year, actually, they will only make their appearance towards January next year. There's 6 triggers in this case study. And then just with Arabang, the students are also going to engage with Mr. Ntuli, who's a taxi driver that was in an accident, and now he's got everything that can go wrong happens to poor Mr. Ntuli and his mother and his wife and everyone. So they're going to engage with them. And then we've spent a lot of time building Arabang's village. So now Mr. Ntuli is just moving in on the other side of the village. So we didn't need to start everything from scratch. This is just an example of what we received from the lecturer. So from the lecturer, we received like a picture of a lady fetching water, and then next to it, it's what it looks like in Minecraft. And then the key takeaways from this project for us as learning designers, because I know there are a few learning designers on the call as well. So accurate design improves educational value, and then also the process supports the co-creation. So we work very closely with the lecturers in designing these games because they are the content experts and it is their game in the end. So key takeaways for lecturers. So a narrative or case study works best, but if lecturers don't have that, we work around it. Like for physio, we are busy with a whole game on physio theories that they use there. So we've built a whole game around those theories because the students find it quite boring. So we've made it more interactive for them with breakout rooms, and you can't go to the next room if you don't know what the specific theory is, etc. So the lecturers then provide the case studies to us, and then they sit back and see the magic happen with their inputs along the way. So depends on how far away the project is, but we either meet monthly with the lecturers or bi-weekly with them. So now I've spoken a bit about the vision and how we build and the blueprints. So now it's your turn. You can imagine yourself standing next to the table and designing your own game, because I'm sure you might be thinking, oh, but this might work for OT and Fisher, like I just mentioned, but what about my course? So here is some of the examples of games that we've done before that we're busy with. So we've done a few nursing games. We're busy with a nursing orientation game as well for the beginning of next year. Medicine and surgery, we're busy with an ICU walkthrough. The physio game I've spoken about for pharmacy. We've created this pharmacy where the students actually need to go in and see if everything is okay and up to standard, do a pharmacy inspection. This helped us a lot during COVID as well. And at the moment, we are busy with an allergy and anaphylaxis articulate game. So I want to show you this YouTube video. I hope the sound and everything works. Just let me know if you can't hear. Can someone indicate if you can hear? Maybe Shira?
We can't hear, Amanda.
Okay, I wonder. Okay, it doesn't. I'm not sure why it's not, but I can just forward a bit. I'll share the link to the game with you. I mean, to the video as well. So yeah, let me just leave it out because I'm not sure why it doesn't want to work now. It worked when I tried earlier.
Amanda, maybe you might need to share with sound.
Yes, I know, but now because yeah, it's probably going to be a bit tedious to share with sound now. Yeah, especially if it doesn't work. Sometimes if it doesn't work, I have to restart the whole computer. because that's how it works. My computer works. So thanks for the tip. So, but I'll share the link with everyone. So the video that I wanted to play was just the showcase of exactly all the games that we've designed so far. So that you can have a look at that. So now, as I said, it's your turn. So if you want to encourage engagement in your classroom, because for me, that's one of the biggest plus sides of gamification and game-based learning, is you need to identify the learning outcomes. So what do you want them to know or do? For example, the Arabang game, understand challenges of rural healthcare delivery. So it usually helps to start with one unit. Like with occupational therapy, we started with one unit in 2019, and now we are adding on to that. So now we've got 2 units there. With nursing, the same thing. We started with one unit, and now we are adding on to that. And it doesn't need to even be like a whole Minecraft world. It can just be adding badges to the learning management system. And then after that, you choose your game or platform that you want to use for the gamification. If or not easier to guide you in that as well, or I'm sure the Shira's team is also available to assist with that. So then step 3 is you design the scenario or challenge. This is a very fun part for me. So that's kind of like exactly how is it going to play out? What do you want the students to learn? So you define the tasks, and then step 4 is you add the game mechanics. So the game shouldn't be too difficult. It shouldn't be too easy. You should have elements there for people that are slower and people that are faster. So that's what you add then. And then step 5 is you build or customize the game. So what we do is we then, about 2 months, or it depends on the timeline, a while before the game goes live to the students, we have a pilot with about 10 people. And then we just see how this game actually works. And then step 6 is we facilitate and reflect. So we let students explore the tasks, and then we do the debriefing at the end. Because the good thing about gamification is that you can get another chance and no one actually gets injured, especially in health sciences when you work with patients and patient scenarios. The downside is that because the students get so involved because of the psychosocial moratorium, they need intense debriefing. So the psychosocial moratorium is like a young child playing a Superman game or watching Superman on TV and then trying to fly off the roof. So that's how involved the students get with the games. And then this is just this picture of the Ifundanati team that is behind all of this. I am talking to you today, but there's a whole team behind the scenes. We don't have Charlie on this picture yet, but next time we'll share that with you. It's a picture with her included. And then thank you. That's me. I'm going to open for questions now. So please get in touch so that we can talk a bit more about this. There's a QR code with a form that you can complete if you have more questions or more information. We're also going to host a game-based learning symposium in May next year here at the E-Zone, and we would love for you to be part of that. So thank you very much, Shira. I don't know if there's any questions.
Thank you, Amanda. That was really great presentation. So yeah, is there anyone from the group that attended that have any questions, suggestions, comments? Kim, please go ahead.
So I love the idea of this. I think it's super cool. So Nancy and I are from SpeechPath. So we obviously work quite similarly to OT and physio. So I think it would work brilliantly in our profession as well. But how much does putting a game like this together cost? I'm assuming there are costs involved, and then just wondering how much and where people are finding this funding from.
So it depends on the platform that you use. I think the biggest cost at the moment is the timing cost that's involved because of so like I said, at the moment we are using platforms that are freely available at Wits, Articulate we had to buy a license for. But I think the biggest investment at the moment for where we are is time and then the platforms. But if you want to get someone to design a game for you, it can cost anything. I can make up numbers here, but it can cost anything. Like, for example, a Unity license is 10,000 Rand per year. But at Wits, if you're in therapeutic sciences, you've got Ifunanato that can help you. I know the CHSE would also be able to help. And then we actually have a gaming lab at Wits as well in the School of Digital Arts. So I hope that answers your question.
Yeah, thanks.
I think the important thing is to, when you want to start, to engage with the relevant people to budget and plan so that you are not wasting time and resources by, finding out what you should be doing to get the guidance. Gavin.
Thanks, Azelle. Yes, and thanks so much, Amanda. That was a fantastic presentation. I also think it's a very cool idea to get students engaged. I just had a question. You did mention that there is a bit of some of the students struggle to get to know how to play the game, maybe navigation, all of that. And as we know, it's probably a different literacy that many students haven't been exposed to in the past. I was wondering how much onboarding is required for many students that aren't gamers as such. I know many of us are these days gamers, but those that haven't played Minecraft or don't know how to operate a directional character in a 3D world, is how much learning does need to take place first to get the literacy, and is that a barrier in any way? And then a related question, how does this, I know you said it levels the playing field, but if many people are gamers, does this maybe create disparities that those have never been exposed to 3D worlds like this? Yeah, so just I had some queries around that, how long it takes to get the literacy up to speed before they're actually doing the learning of the concepts and not the learning of the game itself.
Thanks for that question, Gavin. So the biggest challenge, especially with Minecraft, is that the students don't have the mouse skills. They struggle using a mouse. Many of them do, because it's easier to play Minecraft with a mouse than without it. So what we do now is we kind of have a half an hour session with the students the day before the game or the day of the game. Usually lecturers book out a morning to do the activity, and then later on the game is available to students if they want it. So what we do now is we kind of have an icebreaker digital literacy session of half an hour, just orientating them to Minecraft. So I would say the onboarding is about half an hour. It depends. Some students we give them the opportunity to stay after the half an hour or come later if they're embarrassed, but that's very few and far between. And then also some classes, we also give them the option to play 2-2 at a computer, especially if they're unsure. So I would say the onboarding for Minecraft specifically is about half an hour to an hour. And then the other games like Articulate, there's no onboarding because you click through the page. Yeah.
Awesome. Thanks, Amanda.
Good.
Amanda and Gavin, the question that you've asked is raising another key thing, is that you need to be intentional or have to allocate time if you want to embed game-based learning in your teaching approach, that you are not disadvantaging some students. So it's a key thing to consider. So thank you for that question, Gavin. Tanya.
Thank you. Thank you for the presentation. It's very interesting as a concept. And what I'm wondering is whether, and I'm not sure if it's easy to answer, but whether this is an efficient way of learning. So it sounds like it takes a lot of time to create the game, and obviously there are a limited number of concepts or key facts or whatever it is that we, or the content that we need our students to take away from this process. And then actually, I imagine going through the game is also probably fairly time intensive, and I suppose that varies. But what I'm wondering is like, is this a good bang for buck kind of way of introducing concepts to students?
That is a very good question that you are asking. So at the moment in therapeutic sciences, we are using it as a form of gamification and not as game-based learning. So it is an add-on to the lesson already. So just to use the occupational therapy example, again, they have 6 triggers and the lecturer works with them through the triggers. And then at the end, kind of as the cherry on top, they come to the E-zone and then they play the game and then they do a spot test directly after. With physio, they also do a spot test directly after. So yes, it is very labor intensive to create the game in the beginning, but online learning or going digital does take time because as Lizelle said, you have to be intentional and you have to think exactly about why you do it and how you do it and what would be the most effective way. But like I always say, if you've done it once and you've done it properly, the resource or the artifact is there for an unlimited amount of time. So after the official or the session with the lecturer in the E-zone, the game is available for students to come and do revision as well. And some students learn easier or better this way. And also like the 6 triggers in OTSI, each group gets 1 trigger, so not everybody does all 6 triggers. So now with this game, they have the opportunity to go through all 6 triggers as well, or if they're struggling with a certain one. So everybody enters the game at the same place, they have the same kind of intro, and then from there, there's a space where they then can select, I want to go to trigger 1, 2, 3, 4, 5, 6, and then they can engage with that more. Research also shows that game-based learning gamification is very engaging. Most of the students enjoy it, but the outcome, the physical outcome in tests and exams hasn't really been tested. There are a few research reports that came out that actually says, yes, gamification, game-based learning works well, but not enough to make a conclusive decision. So that's why I say that it's good for engagement, it's good to get people involved, and it's also good for the student to fail fast or to win fast so that they can then immediately see where the problem is and where not. And then also to elaborate on that, it's also the type of game. So if you have a game like simulation type of game, the outcome or the is also different than when you have like what we're doing for pharmacy, the allergy and anaphylaxis game where they actually have to administer medication. So yes, it's still a work in progress, but overall the research says that it works. We just need to see how much the students remember of what they've done.
Renelle.
Hi, everyone. Amanda, thank you so much for the presentation. But I just wanted to add on what Amanda was saying is, game-based learning is really you creating a risk-free environment where students can simulate what they should be doing in a practical way, etc. So if you're looking for a reason why you should use game-based learning, if there's something that is going to give them chemical exposure or whatever it may be in health sciences, it's a good way to fail fast, like Amanda said, but it's also a risk-free environment as well. So that's another plus for adding game-based learning as part of your teaching and learning.
Thank you. Yes, it's. I think it's giving us food for thought to think about how we can, what content or concepts we have in our current teaching, and where there's opportunities to incorporate game-based learning to allow students to engage with the content in their own time, that it's more meaningful because it's. If we think about student self-directed learning or engagement in how they study, might not be productive. And a game, incorporating game-based learning or activities like this can then structure what they learn and how they learn in a more meaningful way. So we need to think and identify areas where we can use this in our teaching. Razia, I saw that you had your hand up earlier, so I don't know if your question has been answered or if you want to contribute or want to ask your question. If there's anybody else that would want to add or comment or just thinking of challenges that you might experience or uncertainties or what help you might need to start looking at game-based learning, please share your thoughts.
I want to ask a question.
Yes, Amanda.
Yeah. So, well, it's a comment and a question. So, like I said, many people feel that this is quite daunting and it's big, and people already don't have time, and now it's time investment and all of that. So, can anyone in the audience think of maybe something in your curriculum that you maybe can gamify a bit to make your life easier? Like, for example, when I was still lecturing, I used to add badges on the LMS in my courses just for the sake of me then knowing where my students are at a glance. So, for example, for each unit or each learning activity, I kind of assigned a badge, and then I can just go to the dashboard and say, oh, okay, 200 students already have this badge. So now 200 students are already at this place in the course. And another thing as well is if they want to start complaining about something that's not working or something that's not there, or they don't know what's going on, then it's easier for them to tell you that they are at badge 500 or this badge or that badge than to actually direct you and tell you that they're in unit 1 or unit 2. So that's how I used badges and gamification in my course, just to make my life and my admin easier. So is there anyone that can think of anything in their courses that might be a small start where they can start? I see Lizelle wrote here that think about how you can convert your case scenarios or decision trees into games. You want to elaborate on that, Lizelle?
Yeah, I think it's a good start for me. It's a good starting point because we all have case discussions or ethical dilemmas or problems that we are posing for our students. And it might be a different way of mapping that problem or a situation or case scenario into a branching logic where students can make certain decisions, and then depending on the decision that they've made, they're going through down a certain path. So that will highlight the fast fail, whatever you are saying. That's actually a nice mantra that we can start using. So I'm sure all of us have got opportunities, or we are using cases. And maybe, do you think that that's a way for you to start presenting your scenarios in a different way? Do you, in your disciplines, do you think there's an opportunity for you to embrace this? I'm gonna pick on people. Gavin?
Hi, Lizelle. I was thinking about it. It's an interesting one. It's, in our molecular sciences, for example, we can definitely gamify in many ways if we have simulated 3D environments as well. But it's this balance between authentic learning and decreasing the resolution to where it's, there's a lot of effort to no benefit. How much authentic learning is taking place. And I think there are better contexts for it, maybe, community-based or certain types of scenarios, contexts that help. So maybe Minecraft isn't appropriate for my laboratory space, for example, my molecular science, but maybe badgification or achievements in some way can be used in many ways. It's this thing though, getting out of the idea that professionalism, you don't want to reduce the professionalism to I'm just thinking of this conversation about reducing the expert and identity of professionalism and this need to achieve small iconified badges. So that's what I'm thinking here. Perhaps others are thinking the same. I'm trying to see how it's best worked, and I think there are certain circumstances, but it is hard we have to have intention, and I think not everything can be gamified. I think there's a place and time. That's my thoughts at the moment.
I like what you are saying, and you are also highlighting a key point, because it has to be fit for purpose, and Minecraft might not be the ideal platform, specifically if you want realism, but there might be other ways of animating your case scenarios so that it is more interactive. So it's more around the interaction and the engagement rather than the authenticity, but it has to be fit for purpose. You cannot just take something and say, now I'm going to create a game out of it, and then it loses its meaning, or the student is learning the wrong thing through engaging with the game. So that's a very important aspect. So Amanda, maybe we can pose the question to you. What questions should somebody ask themselves to when they want to start with devising a game or making decisions around, I want to convert content? What are the criteria that you need to, or almost like a checkbox, tick box that you go through to say, okay, is this appropriate to be built on in Minecraft? I don't know if my question is clear. Sometimes my English is failing me.
It makes sense. And even though I did showcase Minecraft now, that's not the only game design platform that there is. And just to Gavin's point as well about the professionalism, we are busy with a microbiology game, or we're actually only starting discussions with the lecturer at the moment. And all I can tell you is the content is like super difficult. I can't pronounce half of the words, but we are busy designing a game in how to teach some of the concepts there, because the students are struggling with that, and we are going to do it in an escape room type of a setting. So the student has the content, they read the content, etc., and then questions are posed. We're still finalizing the platform that we're going to use. It will most probably not be Minecraft, but then they need to answer certain questions about microbiology in order to exit and go to the next room or whatever else. So back to you, Lizelle, and the questions that you need to ask is, I think many lecturers that come and speak to us, usually their first sentence is either, I have this piece of boring content that the students and I hate. Can you please make this more fun? That's the one scenario that we usually get, or we get another scenario of the students are struggling with this specific part of content. They keep on failing their course because of this specific unit. I've tried everything. I'm willing to try gamification as well. So that's the two main scenarios that we get from a lecturer's point of view 9 out of 10 times. But I think the question that you need to ask yourself is there decision trees involved in this content, like Lizelle said? So is there an opportunity for you to create a learning path out of this content? And I do agree that there's a time and a place for gamification and game-based learning, but I do think there's a time and a place 99.9% of the time as well. Because if there's a learning path or a thought process that needs to happen, and you can form a decision tree from there, then I think it can be gamified. But I think if you want to start somewhere, maybe start with something small, like I've mentioned before, and then one unit or one module or one lesson, and then see if it works for you. If it doesn't work, we all have different teaching styles as well. But what I like about the games that we're spending so much time on now is that it's also a resource that's available to students after the fact. So they can come, we can share the file with them, or they can come to the e-zone or wherever on campus, and then they can engage with the content in a different way. Because I always say, out of 100 students in the class, 30% is going to love the game, 30% is going to hate the game, and then the other 40% is doing it for the sake of doing it, and then we usually win them over. But you do have your students that will never understand why you're wasting their time creating a game, and why you're wasting 2 hours of class time while playing a game. We get that. But then there's also other students that will tell you, oh, wow, this is something new, this is something different. thank you for trying something different, and thank you for seeing how we can accommodate everyone. Did that answer your question, Lizelle?
Yes, I think it's the approach of looking at your content and say, okay, is there a learning journey? Is there a decision process that needs to be made? Is there a reasoning approach from the student side? We have got 10 more minutes before we end, so thank you, Amanda. Is there anybody else that want to add their thoughts, thinking that, you know what, game-based learning is never going to integrate into your discipline, or even if you think that, you know what, we need to take small steps and considering what support you would need, we would love to hear your thoughts. If there's no further burning questions, comments, then I am going to say thank you for joining. Thank you, Amanda, for preparing a nice presentation for us and engaging with our questions. And we will see you next week.
Thank you, Lizelle. Thank you, everyone.